Declaration: The written English of COVID-19 epidemic trend analysis and discussions are written by my friends, not by me. To avoid misunderstanding or misleading information of their true meaning of thoughts and cogitations, with their permissions, I directly use their written English in this video. Hello everyone, this is Talk in DC. I'm Jason. My friend Tony, he could not sleep last night because he is so worried about COVID-19 pandemic situation. So he posted another analysis about COVID-19 epidemic trends. Today, I'm going to talk about his analysis about latest COVID-19 epidemic situation. He said, I spent a little time today and assembled a few new graphs for COVID-19. This time, I did not do the tedious and more time-consuming daily and cumulative trending charts. Instead, I just used the most up-to-date data and constructed a series of simple bar graphs to show the snapshot of today at both world and US levels. All data used are reflected through April 19, 2020. First bar chart, confirmed cases. This graph shows how US measured up with other countries and the rest of the world in terms of confirmed cases. Unfortunately, we are the undisputed champion in this category, leading the second place Spain by a factor of 4. Note, only countries with more than 100,000 confirmed cases are compared. Second bar chart, number of fatalities. Similar to the first graph, but compares the number of deaths. Again, US is topping the world in this aspect. Note, only countries recorded more than 1,000 deaths are included. Third bar graph, confirmed cases normalized. While US occupies the top slot for total confirmed cases, we are not as bad after factoring in the population element. We registered 2,394 cases for every million people, or among 1,000 US citizens, we would roughly encounter 2.4 confirmed cases. The world average is 308 confirmed cases per a million population. US is about 6 times higher than the world average in this regard. Note, only countries with more than a million population are included in the comparing bars. Fourth bar graph, death tolls normalized. Similar to the third graph, and after the death tolls normalized, US retreated its top position from highest death tolls nation to the 9th place among countries with more than a million citizens. For every 1 million people, US encounters 122 fatalities by the pandemic. This figure is 6 times higher than the world average of 21 deaths per million, but only a quarter of the top normalized death number recorded by Belgium at 490 deaths per million. Note: only countries with more than a million population are included in the comparing bars. Fifth bar graph, number of tests. U.S. registered the most coronavirus tests among all nations in the world, followed by Russia and Germany respectively at about half the figure of ours. Note: only countries conducting more than 150,000 tests are compared. Sixth bar graph, test figures normalized. For every 1 million citizens, U.S. has conducted 11,640 tests, or equivalent to roughly 12 tests per every 1,000 people in the U.S. This figure placed U.S. on the 27th place in the world, not particularly an impressive figure considering our vast number of confirmed cases. The world champion on this front is UAE, United Arab Emirates, followed by Bahrain. Both are Middle East oil-rich Arab countries, with 77,050 and 50,028 tests for every 1 million people respectively. The world average is 2,590 tests per 1 million people. Note: only countries with more than a million population are included in the comparing bars. Seventh bar graph, mortality rates. It appears the death rates rise as pandemic progresses. U.S. is currently recording a 5.9% of mortality rate as compared to the world average of 6.9%. Many European countries are registering double-digit death rates, led by Belgium's astonishing 14.8%, followed by UK's 13.4% and Italy's 13.2%. Comparatively, Taiwan's death rate has been excellent at 1.4% today. Note: only countries with more than a million population are included in the comparing bars. Eighth bar graph, confirmed cases per test. In calculating the number of confirmed cases per COVID-19 test, I hope to establish a relevant reference of how deep the virus spread has penetrated through a nation. So far, for every 100 test runs, U.S. yield 19.8 confirmed cases. In other words, on average, 1 in every 5 tests generates a positive result in the U.S. The world average is 11.7% so far, or about 1 in 9 tests yields a positive infection. France is having the highest virus penetration thus far in the world, with 1 out of every 3 tests went positive, followed by its 2 European neighbors, UK and Belgium. Both return 1 positive case in every 4 tests. Note: only countries which conducted more than 150,000 tests are included in the comparing bars. Ninth bar graph. Confirmed cases in the U.S. Similar to the first graph, but limited to the U.S. only. New York State, with 250,000 confirmed cases, is by far the most infected area in the U.S. and in the world as well. Her neighbor, New Jersey, is a distant second. Maryland and Virginia sit at 13th and 18th places, with 12.8K and 8.5K confirmed cases, respectively. Note: only states with more than 4K confirmed cases are compared. 10th bar graph. Death tolls in the U.S. Similar to the second graph, but limited to the U.S. only. New York State, with more than 18K fatalities, is the epicenter of the U.S. Maryland and Virginia, now at 14th and 18th places in terms of number of deaths, with 488 and 277 respectively. Note: only states with more than 150 fatalities are included in the comparing bars. 11th bar graph. Death tolls normalized in the U.S. Similar to the fourth graph, but limited to the U.S. only. New York State at 933 deaths per million residents has the highest fatalities in the nation and in the world, even after death tolls are normalized. District of Columbia and Maryland ranked at 8th place and 13th place in the nation at 110 deaths and 81 deaths per million residents, respectively. Both are lower than the U.S. average of 122 deaths. Yet, world average is 21 deaths. 12th bar graph. Mortality rates in the U.S. Similar to the 7th graph, but limited to the U.S. only. Michigan and New York topped the nation with both death rates exceeding 7%, 7.6%, and 7.4% respectively. Locally, Maryland, District of Columbia, and Virginia recorded 3.8%, 3.4%, and 3.2% respectively, all below than the world average death rate of 6.9% and the U.S. average death rate of 5.9%. 13th bar graph. Confirmed cases per test in the U.S. Similar to the S graph, but limited to the U.S. only. Again, New York, the disastrously infected state, recorded the highest percentage of confirmed cases per test. Literally, one of two tests, 49.4% in New York, yields a positive return. New Jersey is not far behind. 2 out of 5 tests, 40%, also generates a confirmed case, followed by Connecticut with about 1 in 3 being positive. Areas of these 3 states considered to be the greater NYC metropolitan and thus suffers the most devastating virus consequences. Our local areas, District of Columbia, Maryland, and Virginia, are at 20.4%, 18.9%, and 15.6% respectively in terms of virus penetration. The US average is 19.8% versus world average of 11.7%. Well, done with it for now. Need to have my eyes rested for a while. Good night. After reading my friend Tony's analysis, we have a discussion among my friends. Let's review the discussion. My friend Jay said, I'm very surprised that Sweden has such low normalized confirmed cases and mortality, since it is the only developed country that did not require its citizens to stay at home. My friend Tony replied, there has been serious debates over Sweden's strategy of combating the coronavirus. Some said it would never work, but some praised for its courageous approach that may prevent huge economic downturns. It may still too early to tell which camp is correct, but the current situation does yield some promising outcomes. Their confirmed cases are still relatively flat. Their medical system is not overwhelmed by all means. They do not run astronomical number of tests. Their death rates, while high, are much lower than their European neighbors, i.e., Italy, UK, Spain, France, etc. And yet, their schools, cafes, gyms, restaurants, and bars are still open. It appears their approach has drawn considerable interest around the globe. I think part of selecting their strategy relies on having one of the best functioning health systems in the world, and the Swedish folks, whatever as free as they are, they do respect and practicing social distancing under circumstances. I hope their success, or maybe luck, prevails in the long haul, but really, only time will tell. By the way, thanks for the comments, and I enjoyed the healthy discussions. My friend Wendy replied, totally agree. Actually, both camp of strategies work eventually, but depends on timing. At early stage of the outbreak, strict quarantine and vaccine will save lives and economic. However, wrong timing to start prevention, lousy quarantine policy behavior, plus delayed effective treatment and vaccine all will lead to the path of herd immunity. This path would full of deaths and economic loss. We Americans missed the early timing. Hopefully, the social distance strategy can maximize positive outcome and reduce economic impact down to minimum. Keep our fingers crossed and pray constantly. My friend Wendy also said, well done, Tony. You really live every day. Reading your analysis, I really feel America is a rich and capable nation. We can do so many tests in such short term. Maryland is even better. We can spend $10 million to buy so many test kits like South Korea. Governor Hogan hopes to maximize tests against people as a reference for when to come back to work. According to your graphs, for New Jersey and New York, the number of people likely to be infected is more than 40%. The R0 of coronavirus is 5.7. According to epidemiological statistics, if R0 is 5.7, at least 80% of the people must be infected to achieve community immunity. For these two states, if there is no strict quarantine policy, the goal of reaching 80% of people infected seems not difficult to achieve. It is terrible. Should the government blockade these two states? According to your statistics, the mortality rate of coronavirus in New York State is 5.9%, and Italy is more than 13%. This also confirms what the government has been preventing before, does not want to increase the number of deaths due to the lack of medical system. There are currently more than 90,000 hospital beds in New York for patients with coronavirus, but currently only more than 20,000 hospital beds are used. Think about poor Italy. In the end, the doctor has to choose who to rescue or give up that patient. That is, every time a patient is admitted, another patient is destined to die. Then it is understandable that the mortality rate in Italy is twice as large as in New York State. Now, before we continue to move on, let me explain what is R0 and what do R0 values mean. What is R0? Gauging contagious infections. R0, pronounced R0, is a mathematical term that indicates how contagious an infectious disease is. It's also referred to as the reproduction number. As an infection is transmitted to new people, it reproduces itself. R0 tells you the average number of people who will contract a contagious disease from one person with that disease. It specifically applies to a population of people who were previously free of infection and haven't been vaccinated. For example, if a disease has an R0 of 18, a person who has the disease will transmit it to an average of 18 other people. That replication will continue if no one has been vaccinated against the disease or is already immune to it in their community. What do R0 values mean? Three possibilities exist for the potential transmission or decline of a disease, depending on its R0 value. If R0 is less than 1, each existing infection causes less than one new infection. In this case, the disease will decline and eventually die out. If R0 equals 1, each existing infection causes one new infection. The disease will stay alive and stable, but there won't be an outbreak or an epidemic. If R0 is more than 1, each existing infection causes more than one new infection. The disease will be transmitted between people, and there may be an outbreak or epidemic. Importantly, a disease R0 value only applies when everyone in the population is completely vulnerable to the disease. This means no one has been vaccinated, no one has had the disease before, there's no way to control the spread of the disease. This combination of conditions is rare nowadays. Thanks to advances in medicine, many diseases that were deadly in the past can now be contained and sometimes cured. Now let's come back to continue moving on. My friend Tony replied to Wendy. He said, "That's right, our medical system can still be supported. The biggest reason is that American hospitals only accept severe coronavirus patients. All patients with mild symptoms are isolated at home and heal themselves. This is very different from mainland China and Taiwan. All patients are hospitalized. The total number of hospital beds in the United States is only about 920,000, of which the normal average utilization rate is 80%. Image: if all patients are hospitalized, the current active coronavirus patients is more than 675,000. The medical system and personnel will collapse. There are only 14,000 severely ill patients in the United States, and it is still easy to deal with." The Lombardy area, where Milan in northern Italy is located, was originally a place with high medical standards, but there are also too concentrated retired elderly people. As if you mentioned it before, once the epidemic broke out, all of them were seriously ill and destroyed the whole one at a time. The medical system, the entire Lombardy, has become a tragic world of human purgatory. Fortunately, this scenario will probably not happen in the United States. However, I think the death toll in the United States will continue to rise, and the mortality rate will gradually increase. Due to limitation in length, I will not go into details. We will discuss on the form. The community immunity you said is actually not a bad thing, but I hope that it can be achieved with the vaccine. It seems that it will be more than a year, but it can only be prudent but not overly optimistic. After all, how many years have it been until now the SARS and MERS vaccines that haven't officially come out yet? Herd immunity, which has been passed down from person to person, is too tragic. Oh, I hope that after the arrival of a large number of test kits in Maryland, we can also feel at ease after we are tested. It's nice to have interactive discussions. My friend Wendy replied, "I also believe that the mortality rate is still rising. There are many undiscussed factors in all links. It is really worrying and frightening to think about." Now, let's look at some real numbers. On April 19, when my friend Tony did the analysis, United States concluded with more than 771,000 confirmed cases and more than 41,000 people died. On April 20th, 2020, at 8:13 a.m. Pacific Time, 11:13 a.m. Eastern Time, United States has more than 773,000 confirmed cases and more than 41,000 people died. Globally, we have more than 2,437,000 confirmed cases and more than 166,000 people died. In United States, New York State has more than 248,000 confirmed cases. More than 18,000 people died. New Jersey has more than 85,000 confirmed cases and more than 4,000 people died. Globally, the United States still has highest number of confirmed cases in the world, but most importantly, its number is almost 4 times higher than the second place country Spain. Spain has a little bit more than 200,000 confirmed cases, followed by Italy, followed by France, followed by Germany, followed by UK, followed by Turkey, and then Iran. Another thing to note, China mainland is no longer in the top 8 country list in the world. Also, Germany and Turkey, they both have much lower mortality rates compared to the other countries. Their death toll numbers are even lower than the 8th place country Iran. But UK has much higher mortality rate compared to the other countries. Their death toll number are even way higher than the 5th place country, Germany. Since April 1st, they first published their research study report on the internet. University of Washington Medical School has been constantly updating their report on the internet. This is last updated on April 17. From the graph, it looks like they are predicting the deaths per day is on the downhill path, declining. For the medical resources needed for the COVID-19 patients, we still have more than 8,000 hospital bed shortage and more than 9,000 ICU beds shortage. And also, we may need more than 16,000 ventilators. And the projected deaths by August 4th, 2020 is 60,308 people. Now, let's look at some interesting research study reports. There are several research study reports indicate that men are more than twice as likely to die of COVID-19. KIRO 7 News has also reported the research study report indicating men appear to be more likely than women to die from COVID-19. Medical News Today has also posted a research study titled Sex Differences in COVID-19. In this research study report indicates men more than twice as likely to die as a result of COVID-19. DailyMail.com also posted another interesting research study. That study indicates people with type A blood are more likely to catch coronavirus than those with type O. So, based on these research study reports, I'm in danger. I'm a man with type A blood. I found a very good English slogan from social media. quarantine, no human right. No quarantine, no human left. If we put that English slogan in Chinese, it is 隔离人全没了，不隔离人全没了。Another best English slogan from social media: Quarantine, I see you. No quarantine, I see you. If we put that slogan in Chinese plus English, 隔离 I see you, 不隔离 I see you. There is another best Chinese slogan from social media: 隔离人全没了，不隔离人全没了，人全戴口罩，口罩没了。Okay, that's it for today. Thanks for watching. Please do remember, wear face masks, washing hands, and keep social distance. Stay safe and stay healthy. Bye bye. Have a nice day.